Good morning. Welcome to Medicare 360 Show. I'm Jennifer Lee, your host today. Today we are still continuing our journey on the Medicare and You Handbook. We are now currently on Section 2, page 25, Find Out What Medicare Covers. What service does Medicare cover? In this section, you'll find information about the items, tests, and services that original Medicare Part A and B covers in hospitals, doctor offices, and other healthcare facilities. You may be eligible for the Medicare covered services in this section if you have both Part A and Part B. If you only have Medicare, original Medicare, you'll use your red, white, and blue Medicare card to get your Medicare covered services. Your Medicare card shows whether you have Part A listed as hospital, Part B listed as medical, or both, and the date your coverage begins. So important, if you join a Medicare Advantage plan or other Medicare health plan, make sure your plan's card with your provider to get Medicare covered services. Meaning make sure to share your plan's card with your providers, right? They're not going to know if you don't show your health ID card. Note, if you're not lawfully present in the U.S., Medicare won't pay your Medicare Part A and Part B claims, and you can't join a Medicare Advantage plan or a Medicare drug plan. So a little side note on that. Typically, if you are living out of the country 6 months and a day, they don't like that, right? So I know there's some that retire or just visit often to different places. It's typically that 6 month and a day that you're technically not really living in the United States as they count it. So what does Part A cover? Part A, hospital insurance, helps cover your inpatient care in a hospital, your skilled nursing facility care, your hospice care, and your home health care. Pages 26 to 29 list common services Part A covers and general descriptions. For more information on Part A covered services, visit medicare.gov/coverage. Note, go to pages 119 to 122 for definitions of bluebirds. And we could definitely talk about that later. So let's continue on page 26, section 2, find out what Medicare covers. What do I pay for Part A covered services? Co-payments, co-insurance, or deductibles may apply for each service listed on the following pages. If you're in a Medicare Advantage plan or have other insurance like Medigap, Medicaid, employer, retiree, or union coverage, your out-of-pocket costs like co-payments, co-insurance, or deductible may be different. For more information about costs, contact your plan. Of course, contact us because we are brokers and agents. We don't only represent one company, we represent the client. You could also call 1-800-MEDICARE, but truly believe, call us and we can help you with that. Part A covered services, blood. If the hospital gets blood from a blood bank at no charge, you won't have to pay for it or replace it. If the hospital has to buy blood for you, you must either pay the hospital costs for the first 3 units of blood you get in a calendar year, or you could call someone else can donate that blood. Home health services. Part A and or B covers home health benefits. That's on page 43. Hospice care. To qualify for hospice care, a hospice doctor and your doctor, if you have one, must certify that you are terminally ill, meaning you have a life expectancy of 6 months or less. When you agree to hospice care, you're agreeing to comfort care. palliative care instead of care to cure your terminal illness. You also must sign a statement choosing hospice care instead of other Medicare covered treatments for your terminal illness and related conditions. Coverage includes all items and services you need for pain relief and symptom management, medical, nursing, and social services, drugs for pain and symptom management, durable medical equipment for pain relief and symptom management, aid and homemaker services, other covered services you need to manage your pain and other symptoms, as well as spiritual and grief counseling for you and your family. So let's stop there. Like the grief counseling, I have seen like priests and pastors come. Durable medical equipment could compile as like, like those beds that go up and down with the guardrails. Aid and homemaker services, just on a side note, um, it does have that. I see like nurses come in, but an actual aid and homemaker, unless just personally they've told me, we can't give you X amount of hours for that. So be cautious of that as well. So Medicare certified hospice care is usually given in your home or other facility where you live, like a nursing home. Original Medicare will still pay for covered benefits for any health problems that aren't part of your terminal illness and related conditions, but hospice should cover most of your care. Medicare won't pay for room and board for your care in the facility unless the hospice medical team decides you need short-term inpatient care to manage pain and other symptoms. This care may be in a Medicare-approved facility, like a hospice facility, hospital, or skilled nursing facility that contracts with the hospice provider. So just also keep in mind, I've seen hospice patients in conjunction with other insurance, such as the Medicare Advantage plans or the Medicare supplement plans. Hospice really is a big business. So the bad side about this is that there's a lot of fraud, waste, and abuse. I've seen seniors tell me that these companies approach them and give them money to get on a hospice. I met this lady once and she's like, oh, I was getting $300 a month, but it expired. And I'm just like, wow, how are you getting $300? This lady was perfectly healthy and came up, it was hospice. I'm just like, you know what? That's actually fraud, right? You're not supposed to have kickbacks. I mean, hospice is really for people that are ill, terminally ill, and don't want you to resuscitate. This is just another conversation, but I've dealt with hospice fraud, and it's not, I mean, obviously when you deal with fraud, it's really discerning and shocking to see that, right? Hospice is you are going to die and you are just trying to alleviate your pain and symptoms, and they're not supposed to resuscitate you. You're not going to be resuscitated. So keep that in mind. Biggest thing is, I believe if the administrator, the nurse is there and someone is passing away and you're like, no, you know what, I want to resuscitate, then you tell them, remove me off hospice, because technically if you're on hospice and then want to be resuscitated, it wouldn't be covered. So things like that, obviously everything's case by case, but definitely let us know and we could talk to you about that. It is very near and dear to my heart because I've had hospice fraud in my family. And unfortunately, the people that were involved didn't want to, in the Asian culture, like they didn't want to tell on these people or so forth. But it was pretty bad. It was a lot of fraud. And I think this is actually one of the reasons, well, the number one reason I went into Medicare, because I needed to understand how Medicare worked for me and my family. I mean, I was licensed and how could I not understand this? So yes, Medicare is definitely could be confusing if you didn't study, and now I'm really passionate about it. Okay, so let's get back. Section 2, page 27, find out what Medicare covers. So caregiver relief and support, Medicare also covers inpatient respite care, which is care when you get in a Medicare-approved facility so your caregiver, family member, or friend can rest. You could stay up for 5 days each time you get respite care. Your hospice provider will arrange this for you. After 6 months, you could continue to get hospice care as long as the hospice medical director or hospice doctor recertifies at a face-to-face meeting that you're still terminally ill. So that's what happens. Like I've seen the fraud where they just move from one hospice company to another. Of course, they are cracking down on this, and I hope they crack down on this because even with my situation, I never saw a doctor come see my hospice father-in-law that was in hospice that we didn't even know about, right? And they were billing at that time 5,000. I've seen it now; it's at 6,000, and this is per month. So crazy, crazy fraud, waste, and abuse. Okay, so you pay nothing for hospice care, a copayment of up to $5 per prescription for outpatient drugs for pain and symptom management. 5% of the Medicare approved amount for inpatient respite care. Okay. Original Medicare will be billed for your hospice care even if you're in a Medicare Advantage plan. I did mention that earlier. When you get hospice care, your Medicare Advantage plan can still cover services that aren't part of your terminal illness or any conditions related to your terminal illness. For more information on hospice care and to find Medicare approved providers, contact your planner or visit medicare.gov/care-compare. So this definitely, I've seen it go hand in hand, so it still does work. Inpatient hospital care. Medicare covers semi-private rooms, meals, general nursing, drugs, including methadone, to treat an opioid use disorder, and other hospital services and supplies as part of your inpatient treatment. This includes care you get in acute care facilities, hospitals, critical access hospitals, inpatient rehabilitation facilities, long-term care hospitals, psychiatric care in inpatient psychiatric facilities, and inpatient care for a qualifying clinical research study. This doesn't include private duty nursing, a television or phone in your room if there's a separate charge for those items. Personal care items like razors or slipper socks or a private room unless medically necessary. I've seen it. Sometimes hospitals do offer private rooms if they have it and is available. If you also have Part B, it generally covers 80% of your Medicare approved amount for doctor services you get while you're in a hospital. In 2025, you pay days 1 to 6 of each benefit period $0 after you meet your Part A deductible. Day 61 to 90 of each benefit period, $419 each day. And after 90 of each benefit period, $838 each day for each lifetime reserve day, up to 60 days over your lifetime. I mean, I find that hospitals don't want to keep you that long, but if they do, that's really the prices there if you're on original Medicare. After you use all your lifetime reserve days, you pay all costs. Part A only pays for up to 190 days of inpatient psychiatric hospital care you get in a freestanding psychiatric hospital during your lifetime. Okay. Page 28, Section 2. Find out what Medicare covers. Note, hospitals are now required to share the standard charges for all of their items and services, including the standard charges negotiated by Medicare Advantage plan, on a public website to help you make more informed decisions about your care. Am I an inpatient or outpatient? Whether you're an inpatient or outpatient affects how much you pay for hospital services and if you qualify for Part A skilled nursing facility care. You're an inpatient when the hospital formally admits you with a doctor's order. You're an outpatient if you're getting emergency or observation services, which may include an overnight stay in the hospital or service as an outpatient clinic, lab tests, or x rays without a formal inpatient admission, even if you spend the night in the hospital. So keep that in mind because I have clients that thought they were at the hospital, but if they weren't really admitted, that means you're an outpatient and the cost might be different. Each day you have to stay, you or your caregiver should ask the hospital and or your doctor, a hospital social worker, or a patient advocate if you're an inpatient or outpatient. I do suggest, they do have advocates at the hospital, but like all things, some are better than others. And I feel that you as a patient and your family should advocate for you as well. You just never know how these social workers or patient advocates will be. Of course, some are better than others, but advocating for yourself is also good. Important. Sometimes doctors will keep you as an observation for observation services while they decide whether to admit you as an inpatient or release discharge you. If you're under observation more than 24 hours, the hospital must give you a Medicare outpatient observation notice, also called MOON, MOON. This notice tells you why you're an outpatient in a hospital or a critical access hospital, getting observation services and how it affects what you pay in the hospital and the care after you leave. You now have appeal rights when a hospital changes your status from inpatient to outpatient if you meet certain criteria. For more information, visit medicare.gov/providers-services/claims/appeals/original-Medicare. Religious non-medical health care institution inpatient care. If you qualify for inpatient hospital or skilled nursing facility care in these facilities, Medicare will only cover inpatient, non-religious, non-medical items and services, like room and board, and items or services that don't need a doctor's order or prescription, like unmedicated wound dressings or use of a simple walker. Medicare doesn't cover the religious portion of this type of care. Skilled nursing facility care. Medicare covers skilled nursing facility care after a 3-day minimum medical necessary inpatient hospital stay, not including the day you leave the hospital. For an illness or injury related to the hospital stay, Medicare covers semi-private rooms, meals, skilled nursing and therapy services, and other medically necessary services and supplies in a skilled nursing facility. To qualify for skilled nursing facility care, your doctor must certify that you need daily skilled care like intravenous fluids, medications, or physical therapy, which as a practical manner, you could only get as a skilled nursing facility inpatient. Medicare doesn't cover non-medical long-term care. So go to page 56. So I would also caution, typically my clients like on a Medicare supplement plan, they think they could just go to a skilled nursing facility after the hospital. But the biggest thing is they actually won't accept you unless it was a 3-day minimum at the hospital, not including the last day. So keep that in mind on that. You may get skilled nursing care or therapy if it's necessary to improve or maintain your condition. So that's page 29. If you disagree with your discharge, you could appeal. So definitely I had a patient or client daughter called me, and unfortunately her dad was in a really bad car accident, and he was at the hospital, and she's just like, what can we do? And I said, usually, if he's not quite better, they will move him to a skilled nursing or like a rehab facility. Unfortunately, it wasn't approved. It was denied. But I told her, you know what? This is when we have to advocate for your dad, and we need to file a grievance. And now her dad is at a rehab facility, a really nice one, and I hope he is definitely getting that care that he needs. So, like, for example, if you do disagree with your discharge, you can appeal. For example, if you're discharged only because you aren't improving but still need skilled nursing care or therapy to keep your condition from getting worse, you can appeal. Go to pages 100 to 101. In each benefit period, for 2025, you pay days 1 to 20 nothing. Note, if you are in a Medicare Advantage plan, you may be charged co-payments during the first 20 days. Days 21 to 100, $209.50 each day. Days 101 and beyond, all costs. Note, you may not need a 3-day minimum inpatient hospital care if your doctor participates in Accountable Care Organization, ACO, or your provider is approved for a skilled nursing facility 3-day rule waiver. If your provider participates in an ACO, pages 1 to 11, ask about benefits that may be available. Medicare Advantage plans may also waive the 3-day minimum. Contact your plan for more information. So that's a really great point, because as an advocate or your own advocate, you definitely need learn these type of rules just to make sure that you're getting the level of care that you need. So what does Part B cover? That's probably the next topic that we are going to go on. Really quick, Medicare Part B medical insurance helps cover medically necessary doctor services, outpatient care, home health services, durable medical equipment, mental health services, limited outpatient prescription drugs, and other medical services. Part B also covers many preventive services. Go to page 30 to 55 for a list of common Part B covered services. Medicare may cover some services and tests more often than timeframes listed if needed to diagnose or treat a condition. Find out if Medicare covers a service that isn't on the list. Go to medicare.gov/coverage or call 1-800-MEDICARE. Users can call another number. So there's a Dandy app actually that you could add on your cell phone, where it shows the Medicare covered services. It's pretty nice. You could definitely just input that type of service and it'll come up, like put chiropractor, and it'll say like exactly what is covered. So I would highly suggest that. So we will continue next week, still on page 29. We will go over what do I pay for services Part B covers. This is all very, to me, it's very exciting. To you may be boring or, something that you definitely need to know, but I love it. I love educating and going over this with clients. So signing off now. Thank you for listening. Your host, Jennifer Lee with Medicare 360. You take care.